Dr. P here talking about nerve number 11, the spinal accessory nerve, but the term accessory nerve really refers only to the nerve supplying the sternocleidomastoid, the trapezius muscles, and therefore it's known as the spinal accessory nerve. Let's draw off the sagittal projection. First, the rostral or cranial component, which is formed by the spinal nucleus of 11. It sits higher up than you would think. It's pretty elongated, and it's not so anterior in its position as the true accessory nerve. So this gives rise to multiple rootlets inside the upper medulla oblongata, and then they converge as a nerve that leaves off to the side. Now we're in the midline, but just for education's sake, the nerve is coming out laterally, coursing anterolaterally, then kind of dips down a little bit before it merges with branches of the vagus nerve. Now the one we're really fixed on right now is the true accessory nerve component of nerve number 11. It's further caudal, it's pretty elongated, it's also more anterior, and it dips down into the upper cervical region. So it's medulla oblongata and upper cervical, and this time the roots come together in a very short fashion, and then they coalesce as the apparent origin of this component of nerve number 11, and then it loops upward. It has a pretty steep upward course before it kind of bounces off the craniad component and then dips down and courses lateral and posterior to innervate the trapezius. Now, injury to the spinal accessory nerve is most commonly caused by medical procedures that involve the head and neck. Injury can cause wasting of the shoulder muscles, winging of the scapula, and weakness of shoulder abduction and external rotation. The accessory nerve is derived from the basal plate of embryonic spinal segments C1 through C6. So if we look at the coronal projection, we'll take our arrows off now, and we scroll off to the side and try and locate the position of the accessory component of nerve number 11. You can see a little wisp of it right there corresponding to this locus right here. Not so easy to see in the coronal projection because of its diminutive size. You can see its companion on the contralateral right side, and as we said, it loops upward. You can see this one looping upward on the right, where it will join the unseen cranial division of nerve number 11.